Thank you. The final item of business is the members' business debate on motion 18138 in the name of Stuart McMillan on improving bladder cancer diagnosis in Scotland. This debate will be concluded without any questions being put, and I would invite those members who would wish to speak in the debate to please press the request to speak buttons, and I call on Stuart McMillan to open the debate. Up to 7 minutes, please.
Thank you very much, Presiding Officer. First of all, I want to thank colleagues from across the Chamber for signing the motion so that we can actually have the debate this afternoon. I also want to commend the work of Fight Bladder Cancer, a relatively small organisation who are dedicated to raising awareness of the symptoms and support that is available for those diagnosed with bladder cancer. I first became aware of Fight Bladder Cancer shortly after the 2021 election, and I was delighted to host their first parliamentary reception in February 2023. This followed the organisation officially becoming registered as a charity in Scotland in July 2022. As I highlighted during my opening remarks at that event, Fight Bladder Cancer's work was first brought to my attention by one of my constituents, Laura Mackenzie, as she is an ambassador for the charity. She highlighted the charity's 4 main objectives to, first of all, support patients, their family and friends and all people affected by bladder cancer, raise awareness about the causes and symptoms of bladder cancer so it can be caught early, campaign for and support research into bladder cancer, and finally affect policy at the highest levels to bring about change in bladder cancer diagnosis and treatment. Now, according to Fight Bladder Cancer, nearly 1,700 people are diagnosed with bladder cancer each year in Scotland. Now, the majority of them are people aged over 60 years old. Now, worryingly though, around 50% of bladder cancer cases are preventable. Now, that tells a huge story about the work that is required to highlight the symptoms of bladder cancer. So I want to take this opportunity to enlist them for awareness. The signs and symptoms to look out for include blood in your wee, which is the most common symptom of bladder cancer, urinary infections that don't respond to antibiotics, pain when weeing, needing to wee frequently, tiredness, abdominal pain, weight loss, incontinence and lower back pain. Now, according to Fight Bladder Cancer's website, very few people will experience all of these symptoms, but that is why people should talk to their GP if they experience any of them. Now, other less serious conditions can have the same symptoms too, of course, but again, that is why it's critical that people do not delay and speak to their GP. Presiding Officer, in my opinion, it highlights the need to improve outcomes for patients with bladder cancer. Now, this is because, according to Cancer Research UK, bladder cancer is the 5th most common cancer in the UK after breast cancer, prostate cancer, lung cancer and bowel cancer. However, a report from Fight Bladder Cancer states that, and I quote, "Survival for patients with bladder cancer has not improved over the last 3 decades, with certain groups affected by bladder cancer, including women and those from lower socioeconomic backgrounds experiencing poorer outcomes." Now, other research referenced in the report states that bladder cancer patients experience a high rate of reoccurrence, long and invasive surveillance and expensive treatment. Now, patients also report worse overall experiences than most other common cancers. Now, this is not good enough for patients, but it's also costly for a health service, as bladder cancer has the highest cost of any cancer when considered on a per-patient basis. Presiding Officer, I believe that everyone in the Chamber agrees that prevention is better than the cure, and that could be said for anything, quite frankly. But this approach helps ensure that patients don't endure more invasive and extensive treatment, which is also more expensive to deliver. It's imperative then that we consider how we can support our NHS to better diagnose bladder cancer. And a key part of this, as I've already indicated, is making sure that we raise awareness of the key signs and symptoms. Now, I cannot stress that point enough, and I refer to a previous statistic that half of bladder cancer cases are preventable. Now, part of that work then is considering how we maintain healthier lifestyles. And Fight Bladder Cancer have put together a range of resources to help with this. Now, according to NHS Inform, most cases of bladder cancer appear to be caused by exposure to harmful substances, which lead to abnormal changes in the bladder cells over many years. Now, tobacco smoke is a common cause, and it's estimated that half of all cases of bladder cancer are caused by smoking. It's almost 20 years since the smoking ban was introduced in Scotland. And that was a key public health policy that has helped massively in terms of shifting public attitudes towards smoking. Now, Scotland led the way in this policy in the UK, and I believe that when we are ambitious enough to want to lead the way, then when it comes to bladder cancer. In closing, Presiding Officer, I want to draw to attention the Fight Bladder Cancer White Paper from May 2024. This document includes a range of recommendations that are UK-wide, but there are takeaways for us in Scotland to consider. Now, while there is no one policy or action that will deliver all the changes that are required, there are key areas where we do need to effect change. Firstly, establishing an exemplar pathway for bladder cancer care to help deliver quicker referral and diagnosis for those with suspected bladder cancer. Secondly, strengthening the bladder cancer healthcare workforce will certainly help achieve better outcomes for bladder cancer patients. And we know that this is a key recommendation across several areas in the health service, and Scotland is not alone in facing staffing challenges. Now, thirdly, boosting awareness, support and participation throughout the bladder cancer pathway for patients, carers and also families, and ensuring that patients are empowered to make informed decisions about their care. Now, we know that taking a holistic approach to healthcare and keeping patients informed at all stages of their treatment journey is absolutely vital. Now, that could be said once again about any aspect of healthcare, but it helps them be invested in how they can make small lifestyle changes to support their treatment. And it also helps to safeguard their mental well-being during what really will be a very difficult time. So, Presiding Officer, I want to once again thank members for supporting the motion and also for those who are going to be speaking in the debate. I also want to thank Fight Bladder Cancer for their efforts to improve outcomes for bladder cancer patients in Scotland. And I look forward to continuing to work with the organisation to help deliver this in Scotland. Thank you.
Thank you, Ms McMillan. We now move to the open debate. I call Emma Harper to be followed by Sandesh Gohani. Up to 4 minutes, please.
Thank you, Presiding Officer. Firstly, can I thank Stuart McMillan for giving us the opportunity to discuss bladder cancer. Mr McMillan has highlighted this topic very well, and I thank him for his insight and information. With over 1,500 cases of bladder cancer across Scotland every year, this is a health issue that impacts on every corner of Scotland, including for people in my own South Scotland region. I am pleased we can reach out to the wider public and raise some awareness today of the impact of bladder cancer. Reaching people is crucial for early detection. Like other health conditions, the earlier symptoms are reported and diagnosis takes place, the better the chances for treatment to be effective and the better the prognosis for patients. And Stuart McMillan has highlighted this already. The current cancer strategy adopted by the Scottish Government puts early diagnosis and treatment at its heart, and I know in turn that the health professionals across our NHS feel the same. We should equip the health professionals, particularly in primary care settings, with the training and support that enables them to work with patients in identifying symptoms early and, if diagnosis is made, enable expedited access to the cancer care pathways. But as I said, making sure the wider public know what to look for to help the professionals make that diagnosis is crucial. And I know this may have been highlighted, this has already been highlighted, but it is worth repeating. The earliest, often first symptom of bladder cancer is blood in the urine, haematuria. Blood in the urine can change the colour of the urine to be pink, red or brown, so that is the first sign to focus on and raise awareness. Other early symptoms can include changes in urination habits, such as frequent or sudden urges to urinate, or pain or a burning sensation when urinating. Pelvic or back pain and frequent urinary tract infections may also occur. I know our NHS works closely with external groups like Fight Bladder Cancer to raise awareness in the wider community, and I urge NHS boards across the country to continue and elevate that work to improve the wider public's awareness of bladder cancer and its symptoms. And anyone watching should spend a few minutes on the Fight Bladder Cancer website, reading it for themselves, and even share the short video on their social media networks. I shared it on mine earlier today ahead of this debate. Presiding Officer, as a nurse before entering this Parliament, I saw first-hand the toll cancer has on those living with it and for the families around them. We've seen over years how diagnosis and treatment has improved as the medical technology has advanced, but we still have too many lives cut short or made harder through cancer that couldn't be treated fully. I also want to pay tribute to the amazing staff across the NHS and NHS Dumfries and Galloway who are helping tackle bladder cancer. It can be harder operating in a more rural setting with all the challenges that presents, but I know from my own experience and from my constituents across D&G that staff work tirelessly to support their patients. I make one small request of the Scottish Government to review the current arrangements that place Dumfries and Galloway in the South East Cancer Network. Our transport and other links connect more to Strathclyde rather than the Lothians, and I've raised this issue on many occasions on behalf of constituents. There may be good reasons for that decision, which was taken more than 20 years ago, but the practical effect for people in the South West is a lot of extra travel to access secondary treatment that could otherwise be provided as part of the West of Scotland Cancer Network. So finally, Presiding Officer, I again commend Stuart McMillan for raising this motion and for giving us the opportunity this evening to speak about this topic. Thank you.
Thank you, Ms Harper. And I call Stanish Gohani to be followed by Cara Mochan. Dr Gohani.
Thank you, and a declaration of interest as a practising NHS GP. And I would like to thank Stuart McMillan for bringing this underknown cancer to debate. Bladder cancer is the 11th most common cancer in the UK, with around 60 people diagnosed every day, according to Action Bladder Cancer. Yet outcomes remain uneven. In Scotland, 5-year survival continues to fall short compared with the rest of the UK and with much of Europe. Now, this is not because our clinicians lack dedication or expertise. It's because too many cases are diagnosed too late and because services across the country are stretched. So what can we do? Well, the first and most important step is to raise awareness. So we've heard already that blood in the urine, even once, must never be ignored. Persistent urinary symptoms. Anything changes as you go to the toilet. Basically, you want to seek some help. And if people recognise these warning signs, getting early help can absolutely help against cancer. And the one thing I would love to say, and I think all of us across Chamber would agree, that if things change in your body, or you find that that change doesn't go away, come speak to a GP. We're a friendly bunch, and we'll be happy to hear what's going on. But awareness on its own can't just close the gap. Diagnosis and treatment depends on having the right staff, the equipment and capacity in place. And across Scotland, GPs, nurses, urological surgeons, oncologists, radiologists and many others provide extraordinary care under great pressure. There is some good reason for optimism, though. At Dundee University, researchers have developed a light-based test that detects certain chemicals in the urine. And in trials, this test was accurate more than 8 times out of 10, because it only requires a urine sample. At the University of Edinburgh, researchers are exploring ways to personalise bladder cancer treatment by studying biological markers and advancing imaging features, and they are working to match therapies more closely to each patient's individual tumour. Elsewhere, a study funded by Cancer Research UK with the University of Birmingham and industry partners has shown that a new urine-based test can detect tumour DNA in 87% of cases, and this technology could reduce the need for repeated invasive camera examinations that are often uncomfortable. Innovation of this kind, whether Dundee, Edinburgh, or through partnership across the rest of the UK, is already changing what is possible. Artificial intelligence is another emerging tool. AI systems are showing promise in reading scans and analysing pathology results. With appropriate safeguard, these tools could help clinicians identify high-risk patients more quickly and prevent any delays. And Scotland is well placed to take and play a leading role in integrating AI responsibly into clinical practice. And alongside clinical advances, we must also recognise the vital role charities and patient organisations play. Fight Bladder Cancer, for example, supports patients and family to raise awareness and ensure the patient voice is heard in policy and research. And this work reminds us that progress is not only about survival stats, but also about dignity, reassurance and hope. The priorities then are clear. We need stronger public awareness of symptoms, sustained investment in staff and resources across both primary and secondary care, commitment to research and innovation, and deeper partnership with charities and community. And then by bringing all these elements together, we can change the story of not just bladder cancer, but all cancers in Scotland. We can improve survival, reduce variation in care, and ensure that every patient has the best possible chance. Deputy Presiding Officer, This is not about adding to clinical workload, it's about building capacity, sharing knowledge and empowering patients. And with focus and collaboration, Scotland can move from lagging behind to leading the way in bladder cancer care. Thank you.
Thank you, Dr Glahani. And I now call Cara Mockin.
Thank you, Deputy Presiding Officer, and can I thank Stuart McMillan for bringing this debate to the Chamber. And can I thank him for his contribution, raising so many of the issues people with bladder cancer face. In actual fact, when I was listening to the debate, I would like to thank Emma Harper for her contribution around her nursing experience, and to Dr Glahani there for some of the other technologies that we can use. I thought it was really, really helpful, all the contributions so far. And it is really important the Parliament considers this cancer, given the poor outcomes here in Scotland. And Mr McMillan described the reasons for this really well, so I won't set them out again. Raising awareness of cancers such as bladder cancer is absolutely pivotal to ensuring early diagnosis and improving prognosis. From my own short contribution this evening, I wanted to particularly raise health inequalities. We all know that current health inequalities in Scotland are significant and, unfortunately, and I know we all agree this, that they are worsening, particularly healthy life expectancy, with stark differences between the most and least deprived areas. And we really all want to make a difference to this. We know health inequalities exist across a range of health conditions, including coronary heart disease, diabetes, chronic pain, poorer oral health, and crucially in tonight's debate, in cancers, but also in cancer screening, and making sure that those communities will come forward in a timely manner to get checked out. The latest public health figures show that the incidence of all cancers were 24% greater in the most deprived areas compared with the least deprived areas, and death rates 78% higher. And within this chamber, we take that very seriously. I know that, and the Minister, I'm sure, will remark on that, but I know that it works hard to make sure that we have strategies to address this. Screening and early detection is incredibly important if we're to turn around outcomes from cancer, and as we've heard tonight, particularly bladder cancer. We know that people do not always come forward to get any tests and screening. And we have the opportunity with screening to make sure that our most vulnerable constituents do access these important factors. I know at times the Government have run early cancer detection campaigns, which I really support. And in my research for this particular debate, I was particularly pleased to read about the STV and the Fight Bladder Cancer campaign, Blood and Pee. The campaign in Scotland ran in December 2024 to raise awareness of bladder cancer, and that was one of the only things that I could find in terms of specifically running campaigns for bladder cancer. And in this particular campaign, of course,
Emma Harper.
Thank you. Thank Cara Mockin for taking that intervention. The STV campaign was an excellent campaign, but for folk like me who live in the south part of Scotland that doesn't get STV, would you think that it would be a good idea that we could be lobbying ITV Border to maybe mimic the same campaign?
Always through the chair, Cara Mockin.
Thank you. It's a fantastic suggestion. I think you're right that we need to make sure if we have a good campaign that's working, that we get it out right across Scotland. So any channels that we can use, we should all put our sort of forces behind that. And that campaign in particular, in the notes around it, it particularly talked about lower income communities. And the campaign really did try to encourage people from all backgrounds to access their GP immediately if they had any problems. The initiative aimed to combat late diagnosis, which we've heard is a real major issue contributing to that poorer outcome for bladder cancer in Scotland. And by encouraging people, particularly those in those lower income areas, we know we can get better outcomes. So I really just want to thank Stuart McMillan again for bringing this to the Chamber, for the great contributions from other members. And I know that the Minister will also give us a good contribution this evening. So in closing, Presiding Officer, I hope that having this debate, we have started to play our part in turning this around. I thank all the health staff, charities and families affected for the information that they share, which allows us to debate in this way in this chamber. Thank you, Presiding Officer.
Thank you, Ms Mockin. And I now call on Minister Jenny Minto to respond to the debate. Up to 7 minutes, please.
Thank you, Presiding Officer. I too would like to thank my colleague Stuart McMillan for bringing this motion to the Chamber tonight and welcome the opportunity to close the debate on improving bladder cancer diagnosis in Scotland. I would also like to record my appreciation to Mr McMillan for the hard work that he has done and his continued engagement with and raising awareness of cancer, especially those less well known like bladder cancer. And I think, as Carol Mockin said, this has been a very helpful debate in doing that, and I would like to thank all my colleagues for that. On behalf of the Scottish Government, I firstly wish to recognise all those who are affected by bladder cancer. Adjusting to a cancer diagnosis is never easy, and I understand the impact this has not just on the individuals themselves who are diagnosed with this cancer, but also their loved ones. In supporting people with this, I wish to give recognition and thanks to third sector organisations and groups like Fight Bladder Cancer, who provide invaluable support, help and information, and as others have noted, their website is a fantastic resource to anyone affected by bladder cancer. I would also like to record my thanks as they are part of the Scottish Cancer Coalition, and the support that they give the Scottish Government is very much appreciated. I also find my conversation with the charity when they were in the Parliament extremely helpful and informative. And as Emma Harper has highlighted as well, and others, their resource, as I've noted too, their website is incredibly important. Cancer remains a national priority within the Scottish Government and across NHS Scotland. That's why we pushed our cancer strategy for Scotland 2023 to 2033, along with initial 3-year cancer action plan. Our strategic aim is to improve cancer survival and provide excellent, equitably accessible care. The strategy and plan take a comprehensive approach to improving patient pathways from prevention and diagnosis through to treatment and post-treatment care. We've also developed the early cancer diagnosis vision to reduce later stage disease by 18 percentage points by 2033. As we've heard today, raising awareness of bladder cancer and its symptoms is crucial in detecting this cancer early and improving outcomes for those diagnosed. And I thank Stuart McMillan, Emma Harper and Sandesh Gulhani for all clearly outlining the symptoms. The Scottish Government continues to invest in a range of programmes to detect cancer earlier, because we understand that the earlier cancer is detected, the easier it is to treat. This includes content on our Get Checked Early website, highlighting symptoms and advising when to seek professional advice, including for bladder cancer. The rollout of our rapid cancer diagnostic services are a useful addition to how cancer can be diagnosed in Scotland. They provide primary care with access to a new fast-track diagnostic pathway for patients with non-specific symptoms suspicious of cancer, such as weight loss and fatigue, which can feature for those with bladder cancer. Scotland's RCDSs are ruling cancer in or out faster for those with non-specific symptoms, supporting our earlier cancer diagnosis vision. Additionally, we're establishing urology diagnostic hubs across NHS Scotland to provide efficient and patient-centred care for urology patients. They aim to reduce the number of visits they are required to attend and provide rapid access to diagnostics. There are currently 7 of these hubs across NHS Scotland. And just last month, the Scottish Government published the updated Scottish Referral Guidelines for urgent suspicion of cancer. These guidelines support primary care clinicians to identify those with symptoms suspicious of cancer and identify those who require urgent assessment by a specialist. Referrals are closely monitored to ensure capacity and support is available for those on an urgent suspicion of cancer pathway, including bladder cancer. The Scottish Government recognise that bladder cancer and neurological pathways are one of our most challenged. This is why regional networks are developing improvements relating to workforce recruitment and maximising capacity across the existing workforce. We are directing over £14 million of the £110 million planned care funding made available in 2025-26 across NHS Scotland to reduce cancer waiting times, with a focus on colorectal, urological and breast as our most challenged pathways. We have committed to an additional funding for chemotherapy services reaching up to £10 million. And the Scottish Government is focused to supporting our NHS and social care staff now and into the future. The well-being of staff remains a priority, and our workforce is central to implementing our vision and delivering the outcomes of the strategy and plan. We are working with NHS Scotland to address staffing as a matter of urgency, working closely with NHS boards and clinical leads from across the country to address pressures in a sustainable way. This includes retaining staff in specialist roles and prioritising staff well-being, as evidence shows that positive well-being enhances staff retention and engagement, which in turn raises standards of patient safety and quality care. Whilst I'm proud of the continued prioritised investment to improve cancer services, we must keep reminding ourselves that at the centre of these investments and programmes are people who receive life-changing news when they receive a cancer diagnosis. Understanding the needs and experience of people diagnosed with cancer must remain at the heart of what we do. The results from the latest Scottish Cancer Patient Experience Survey show that 95% of people are positive about their overall cancer care experience. This is reassuring and a positive result driven by those delivering care in our NHS. And we're working in partnership with Macmillan to improve the service we offer patients with cancer through the Transforming Cancer Care programme, worth £27 million. The first programme of its kind in the UK, it provides specialist key support workers who offer emotional, financial and practical support to people with cancer. Patients with cancer will be invited or referred to an ICJ service to speak to a link officer who will complete a holistic needs assessment and generate a care plan to meet their needs. Service users will be followed by the link worker in the community to monitor progress with agreed actions. We will continue to work with Macmillan, our other third sector partners and NHS boards to further improve the experience of people diagnosed with cancer. I would like to offer again my sincere thanks to all members for their contributions in today's debate and to all organisations who offer vital support services to those affected by bladder cancer.
Thank you, Minister. That concludes the debate and I close this meeting.